Okay. Am I audible? Let me know. Then we'll start. Okay, fine. Okay. Now I am audible. I can say that. Fine. Good. Okay. Hello everyone. Welcome to my class. I'm myself Dr. Deepthi Kare. I'm MD PhD Physiology and I'm an educator for Physiology. So before starting my class, I would like to uh, give you one announcement that all my live classes notes, they are available in soft copy as well as hard copy. Okay, in soft copy they are available on the app, that is Vesalius. You can download the app and you can subscribe for the same. And second thing, if you wish to get hard copy of the note, that is available, that is also available, and that is in the form of a book, Physiology Notes, which is available in Flipkart as well as on Amazon. Okay, so you can get your copy. Hello Kishan, welcome to my class. Now let us start today's topic. Today's topic is one of the very important topic, action potential. Yesterday we discussed about resting membrane potential. So if you have not watched that video, you first watch the video of resting membrane potential. Hello Raj, good evening, welcome to my class. Okay, resting membrane potential was yesterday's class. Today we'll discuss about action potential. Now let us start. Hello Avni, welcome to my class. So now, what is action potential? Action potential, first of all, definition. Action potential, that is sequences, try to remember all each and every word. Sequences of events or changes that occur in resting membrane potential after we stimulate the membrane with the help of a stimulus. Okay, I'm fine, Avni. Okay, so you can see here, when we apply stimulus here, this is the resting membrane potential and sequences of events they occur. That is your action potential. Okay, before starting my class, I would like to announce that at the end of my class, I will give 10 MCQs. Okay, so please attend the class carefully and you will be able to get 10 on 10. Fine. Okay, let us start. Okay, so you can see definition of action potential, that is sequences of changes that occur in the resting membrane potential when we apply stimulus. Okay, fine. So here we have applied the stimulus and we will get the changes, that is action potential. Now what is stimulus? Stimulus, that is any change in the external environment, any change in external environment that stimulate the tissue. Okay, now this stimulus may be, which are different types of stimuli, they are mechanical, electrical, chemical or thermal. Okay, commonly in experimental purpose we use electrical stimulus because it is least damaging to the tissue and it can be easily handled. So we use electrical stimulus. Fine. So this is about action potential and stimulus. Now we'll discuss which current we are using for the action potential recording. That is, we use Faradic current. There are two types of current, I think all of you are knowing, galvanic and Faradic current. Here we are using Faradic current. Okay, why Faradic current? Because this is short lived. Okay, and so it causes little change or little damage to the tissue. Damage to the tissue is less. Fine. Now another stimulus type, that is according to strength of stimulus. They are, I'll explain, they are first of all threshold stimulus. What is threshold stimulus? Minimum stimulus required to stimulate the tissue. When it is, thank you Dr. Sheetal, when the stimulus is less than threshold, that is sub threshold, it cannot stimulate the tissue. Okay, threshold stimulus is also known as minimal stimulus. Okay, threshold or minimal. Okay, this is sub minimal. Sub threshold, other name for the sub threshold is sub minimal. Okay, fine. Then threshold, then more than minimal, and less than maximal, that is sub maximal stimulus. Okay, then maximal stimulus gives maximum response. Okay, sub maximum is in between these two, and supra maximal. So 5 types of stimuli are there according to the strength. Okay, let us repeat: sub minimal, or sub-threshold, less than threshold, that will not give you any response. Okay. Second is threshold stimulus, minimum required to stimulate the tissue. Okay. Sub-maximal, less than highest but more than minimal. Supramaximal, more than maximal stimulus. So these are 5 types of stimuli according to the strength. Okay, now we discuss how the action potential is recorded. First of all, for action potential to get, okay, if we apply threshold stimulus, you will get the action potential. Okay, if the stimulus is less than threshold, no action potential. Okay, so now how can we record action potential? We can record action potential by placing electrodes, one inside the membrane and other is outside the membrane, and these two are connected through amplifier to CRO, cathode ray oscilloscope. Okay, and you will get the membrane potential change. Fine. Now, phases of action potential. First of all, resting state or resting membrane potential, this one. Then after we when we have applied stimulus, we have stimulus artifact. What is the ionic basis of each and every phase, we will discuss. Okay, then there is latent period, or it is known as isoelectric interval, that is the period between the stimulus and onset of the contraction. Fine. Then depolarization, this is disturbance in the polarization, that is depolarization. D means disturbance. Resting state is polarized state. Fine. Then firing level, you can see here, this is stimulus and this is the firing level. Okay, once it reaches to firing level, the membrane potential rises very fast, quickly. Then comes, sorry, repolarization. Here membrane potential comes back to the polarized state, this is repolarization. Okay, then later part of the repolarization, that is slow after depolarization and after hyperpolarization. We will discuss one by one each and every phase. Fine. Now, so starting with resting state, we will discuss ionic basis of each and every phase of the action potential. Okay, resting state, that is because of, you can see here, this is the resting membrane potential. Fine. Try to remember this. This is very important for your nerve, for your skeletal muscle, cardiac muscle, smooth muscle and all. Okay. So first of all, resting state means it is a polarized state. Fine. Means negativity inside, positivity outside. Okay. And what is the cause of resting state? Why there is resting state? Because of permeability of potassium ion more than sodium. Fine. Potassium ions are more permeable than, hello Anshu, good evening beta. Potassium ions are more permeable than sodium ions. So what happens, because potassium is an intracellular cation, so potassium ions, they move out. Am I clear? So in the resting state, because of permeability of potassium ion and positive ions, they move out because of leaky channel. Yesterday we have discussed potassium leaky channels. Fine. So this potassium moves out and positivity moves out, therefore inside is negative. Fine. Next is stimulus artifact. Means whenever we are applying stimulus, there is slight leakage of current. When the current leaks, then there is stimulant artifact that is produced. Fine. Next is latent period. You can see here, after the stimulus, slight period, milliseconds period, that is there. About, you can see, 0.5 to 1 millisecond, it is the latent period. Fine. So it is a short isoelectric period after stimulus artifact. Fine. And this latent period depends on two things. Number one is velocity of conduction of action potential. When velocity is fast, latent period is less. Latent period is less. Fine. And distance between the stimulus and the recording point. If distance is more, latent period is more. If distance is less, latent period is less. So these two factors, they decide the latent period. One is velocity of conduction and second is distance between the site of stimulus and the point of recording. Fine. Now, next is depolarization. What is this depolarization phase here? D means disturbance in the polarized state. Okay. So what happens here in depolarized state, depolarization phase, you can see sodium channels, they open. Whenever channel opens, there is passive transport. So sodium ions, because they are more extracellularly. Now the sodium ions, they try to enter inside the cell. Fine. So sodium enters inside the cell. Now initially this sodium entry is slow, you can see, but once it reaches to threshold potential, for example, suppose your in your nerve fiber minus 70 millivolt is the resting membrane potential. So the threshold is minus 55. So when it reaches to minus 55, what happens? There is fast entry of sodium ions. This sodium entry increases at firing level, and influx of sodium ions is along its concentration as well as electrical gradient both, and that is increased by 18 to 20 folds. Fine. So this is firing level. Okay. Huh. So this is depolarization and firing level. Now this, after firing level, you can see there is a depolarization, fast entry of sodium ion. Now this sodium entry, it decreases when this potential reaches to the peak. Okay. Now which are the factors they decrease inflow or entry of sodium ions here? Number one, what happens when the potential reaches plus 35 millivolt, that is the peak. Okay. Then what happens? Your voltage gated, now potassium channels, they are getting inactivated. Initially potassium channels, they are activated by M gate. M gate was activation gate. Here M gate. Okay. Hello Sahit, good evening beta. Okay, so and when this potential reaches plus 35, inactivation gate, this is your inactivation gate, H gate, it closes, and now this H gate will not open till your resting membrane potential is reached. Fine. And second cause of the stoppage of sodium entry, that is opening of potassium channel. And when potassium channel opens, what happens? Potassium is intracellular cation, so potassium ions, they move out, and when potassium ions, they move out, then they result in decrease in the membrane potential. Fine. Okay. Now so you can see here other phases are, you can see overshoot. Overshoot means above zero, when the potential moves above zero, that is very fast and very slow. It reaches, sorry, very fast up and very fast down, that is plus up to plus 35. So this shoot up, fast rising and falling phase of the action potential, that is known as spike potential. Fine. And after, once it reaches to the peak, there is repolarization. Repolarization means now the membrane potential comes back to the polarized state, that is repolarization. Fine. Now next thing we discuss, that is, you can see here what happens, what is the cause of repolarization? Repolarization, that is because of opening of potassium channels. You can see here potassium channels, now they are open, and there is exit of potassium ions, and when potassium ions, they move out, there is there is repolarization. Another important thing, because potassium channels, they are slow to open and slow to close. Okay, slow to close, so this is continue till the membrane potential goes below the resting state. This is resting state, and it may go below. This phase is known as hyperpolarization. Fine. Hyperpolarization. Okay. So this last phases are after depolarization. This number 4 1, this is after depolarization. Initial repolarization is rapid, which is followed by slow repolarization, that is known as after repolarization, and this phase is due to slow efflux of potassium ion. As I told you, potassium channels are slow to open and slow to close, so therefore there is slow closure, and this phase is also slow. Fine. And after hyperpolarization, because of continuous opening of the potassium channel, what happens? The potential goes below the resting state, that is after hyperpolarization. Okay. Now once this is below the resting state, now it has come back to resting state. How this resting state is achieved? This resting state is achieved due to, you can say that, your sodium potassium pump. Okay, because sodium potassium pump now pumps 3 sodium out into potassium in, and because of that, again your resting state is achieved. Another important thing is, because of leaky channels, potassium channels and chloride channels, again your resting state is achieved. Fine. So this is about your phases. Now important note here, This is also you can write down as applied physiology. As I told you, always write down applied physiology and clinical physiology in each and every answer of yours, and you will score more marks. Fine. So when we are talking about applied or important, note, you can just note it properly. So here size and duration of action potential is different for different tissues. You can see here, if we are talking about skeletal muscle, this is few milliseconds. Fine. You can see here this much only. But when we are talking about cardiac muscle, this is as much as 200 to 300 milliseconds. So it is longer for cardiac muscles. Okay. Second important note is, if we are giving local anesthetic agent, this local anesthetic agents, they prevent generation of action potential. Now action potential is generation is prevented by local anesthetics. How? Because they block opening of the sodium channels. So sodium channel opening is blocked, and therefore when sodium channels cannot open, then there is decrease in the excitability and action potential will not be generated. Fine. So these are two important notes here. Another important applied aspect is, if suppose extracellular fluid sodium concentration decreases, you can see here action potential is reduced, strength, or you can say that height is reduced. Okay, because sodium ions are required for depolarization. And if extracellular fluid calcium ion concentration decreases, that happens in tetany. Okay, what happens now? Calcium ions are not available, so sodium ions increase excitability of now because of increase entry of sodium ions. Okay, so you can say that there is uh, increase excitability of the tissue. Okay, and that results in spasm, carpopedal spasm, that is the sign of tetany. Fine. Now properties of action potential. Okay, so properties of action potential, first we discuss about the effect of strength of stimulus. Okay, so strength of stimulus, as we have discussed, when the stimulus is of threshold strength, it will produce action potential. Okay, so threshold means, as I told you, I repeat, 5 types of stimuli. Threshold, that is also known as minimal stimulus, minimum required. Okay, below than that, sub threshold. Sub threshold is also known as sub minimal stimulus. Fine. 1 2 3 3 अभी बाकी रखते हैं. Fourth one is maximum or maximal stimulus. It produces maximum response. In between these two, sub maximal stimuli. Okay, so gradually when we increase the stimulus strength, the response increases. You can see here submaximal, the response increases here. This is muscle response. We are not talking about action potential. Okay, if we are talking about action potential follows all or none law. Means if the stimulus is threshold, action potential, sub threshold, no potential. Fine. So but here when we are talking about the summation that happens in the muscle contraction, that will be there. And 5, that is supramaximal. But when we are giving supramaximal stimulus, there is no further increase in the strength of contraction. Why? Because all the muscles are used up when we have given maximal stimulus. Am I clear to all? If it is yes, give me a thumb in the chat box so I can come to know you are fine, you understood. Okay, now there is relationship between strength duration curve. Means strength of stimulus and duration required to stimulate the curve, and this is known as strength duration curve or excitability curve. Excitability curve, we will discuss in detail this one. This is important point. Now, so what is this excitability curve? This kind of curve is there. What is it? Okay, fine. Excitability curve, that is the relation between strength of stimulus. Here you have to write down strength of stimulus. Here you have to write down time. Okay, strength and duration. Strength and duration of the stimulus. Fine. Now, so what you have, you can see here, this kind of curve you will get. This is not just a free hand. This is the relationship between two things, strength of the stimulus and the duration. Fine. Now you can see here, suppose if you have given strong stimulus, fine, Kishan and Shakshi. So you can see here, when the stimulus applied, that is stronger strength here. So it requires less time. Only we have to apply for this much duration. But if your stimulus is, the strength is less, we require it to apply for long duration. So this is the basic relationship. Strength more, duration required is less. Fine. Strength less, duration required is more. Okay, fine. Now there are some definitions. One, that is Rio base. What is Rio base? Rio base, that is minimum strength of current here, which is required to stimulate the tissue. You can see here below this there is no curve, not like this. Fine. Why? Because you can see here below this, because the stimulus is sub-minimal, so it will not be able to stimulate the tissue. So we require minimal strength of stimulus, and that is your Rio base. So what is Rio base? It is the minimum strength of current or stimulus required to stimulate the tissue. Okay. Second definition, that is utilization time. What is this utilization time? When the strength of current is Rio base, how much time is required to stimulate tissue? Suppose your strength of current is 1 millivolt and we require 10 milliseconds. So this 10 millisecond is your utilization time. Am I clear? Next is your chronaxy. What is this chronaxy? Chronaxy means now what you have to do is you just have to reduce the you just have to apply the strength of current double than Rio base, so the time will be reduced. So what is chronaxy? It is minimum time required to stimulate the tissue when strength of current is double than Rio base. So you can see, suppose Rio base is 1 millivolt, you are applying 2 millivolt current. And how much time required? This one is chronaxy. Very important thing, chronaxy is the unit of excitability. Why? Because if chronaxy is short, excitability is more, means less time is required for the current to stimulate the tissue. Okay, chronaxy is least in the myelinated nerve fiber because they are easily excitable. Fine. So this is first property, strength of stimulus. Second is all or none law. As I told you, if the stimulus is threshold, it will produce response. But if the stimulus is less than threshold, no response. It is not like half action potential. So action potential always follows all or none law. All means if the stimulus is threshold, then action potential, sub-threshold, no action potential. It is electrotonic potential, or you can say graded potential, that is there. Okay, but not the action potential. Fine. Now, again, another important thing is when the stimulus is maximum, the response obtained is maximum. But when we are applying more than maximal, supra-threshold stimulus, we cannot increase the response. You can see here, this is threshold, supra-threshold. The response will not be increased. It is action potential only. We cannot raise the response. Fine. Now, next is refractory period. What is refractory period? Refractory means the tissue is refractory. The tissue will not give any response. Okay, means when we are giving two threshold stimuli successively within short period of time, what happens? Action potential is produced because of first stimulus, but if the second stimulus is given within short period of time, our tissue is not responsive to the second stimulus. Why? Because the tissue is in the refractory period. Now what is refractory period? It is the period during which the tissue will not give any response to the stimulus. Fine. There are two refractory period. One is absolute, this one, and relative refractory period. Okay. Now, so you can see absolute refractory period. What is absolute refractory period? That is it is the period from the onset, or you can say it is the period following action potential, that is from firing level here, okay, to the 1/3 of repolarization. That is your absolute refractory period. Okay, firing to 1/3 of repolarization. This is not properly given here. It should be here. In some diagram they have given it properly. This one you can see here, this one, from firing to, this is exit diagram, it has given it properly. Firing level, absolute refractory period is firing to 1/3 of repolarization. What is the cause of this refractory period? Because during this period your inactivation gate of the sodium channels, they are closed. These are inactivation gates. They are known as H gate. and they cannot be opened till resting membrane potential is achieved. This one, closure of the inactivation gate. Okay, normally when action potential starts in depolarization phase, this activation gate opens. Okay, and inactivation was already open during resting state, but once it reaches to the this firing level, then and at spike potential there is closure of sodium channel because of the closure of inactivation gate, and this can not easily be opened up, and this is the reason for absolute refractory period. Okay, next is relative refractory period. What is relative refractory period? This is remaining part of the repolarization. Okay, here when the strength of stimulus is more than threshold, one can stimulate the tissue. Okay, that is relative refractory period. Okay, and it begins from the end of absolute refractory period up to the after depolarization here, this one, this period. Okay, and during this period you can see sodium channels are inactivated but potassium channels are starting to open, still they are open, and therefore here one can be able to open this M gate, because here resting, we have reached to the resting state. As I told you, when the potential reaches to the resting state, this activation gate can be opened up if the stimulus is greater than threshold. Okay, so one can be able to excite the tissue. That is the your ionic basis. Okay, next property, that is conductivity. Now what is conductivity? That is conduction of impulse action potential that is propagated. It passes from this area to the neighboring and this way. Okay, so propagation, that is in the form of wave of depolarization, that is known as conductivity. Okay, so excitatory impulse that is conducted as a wave of depolarization, this is self propagating. This is because of the circular current flow, and that results in successive depolarization of neighboring area. You can see here, this is depolarization, this is resting state, negativity inside, positivity outside. This is depolarization when positivity inside. Okay, now this is moving here. Fine. Now next is this is, I think we have discussed flow from another is electrotonic conduction. Because of successive depolarization of the neighboring areas, you can see here, this is the area and the neighboring area which is depolarized, action potential travel along the entire length of the excitable tissue. Fine. Now another important thing, it will travel in both the direction, but there is no depolarization of the area just behind the area of depolarization. Why? Because this area is refractory period. Okay, so that is the reason why it is not been depolarized. Okay, so movement of another important thing, once the area is depolarized, the same area is repolarized, so repolarization also moves in the same direction. You can see here, again the membrane is getting repolarized. Fine. Another type of conduction, that is saltatory conduction, which is also known as jumping conduction, that is found in myelinated nerve fiber, because myelin sheath is good conductor of it is a it will not allow the electricity to move. Okay, so myelin sheath acts as insulator and it will not allow the current to flow. Therefore this depolarization wave passes from this node of Ranvier to the second node of Ranvier, and that is jumping, as well as it is fast conduction. The conduction is 50 to 100 times faster as compared to unmyelinated nerve fiber. In myelinated nerve fiber, the conduction is 50 to 100 times faster. Fine. Another type of conduction is orthodromic conduction and antidromic conduction. Orthodromic conduction, that is propagation of action potential in one direction only here. Okay, that is orthodromic. This type of conduction, that is from synaptic junction. At the synapse only one direction transmission is there. Antidromic, that is propagation of action potential in opposite direction, this one. Okay, and velocity of conduction of impulse, that is 0.25 to 100 meter per second, depending on the diameter, depending on the temperature and other factors. Now which are the factors they affect the conduction velocity? Number one is temperature. As I told you, Increased temperature, increased conduction velocity. Second is diameter of axon. Axon diameter increases, conduction velocity increases. And third is myelination. Increase the diameter, more the diameter of the fiber, increase the thickness of myelin sheath, and the conduction velocity also is fast. Fine. So this is the fourth property we have discussed. First property we have discussed, that is strength of stimulus. Second is all or none law, strength of stimulus, all or none law. Third, refractory period. Fourth is conduction of action potential. Okay, so these are properties of action potential. And fifth one, that is accommodation or adaptation. What is this accommodation? You can see here, as when we apply threshold stimulus we will get the action potential. Okay, but if the threshold stimulus is applied continuously, so what happens? Now membrane fails to produce action potential. Now action potential will not be produced. Okay, and this is known as accommodation. Okay, if any excitable cell that is submitted to passage of constant current, the site of membrane fails to produce action potential. So the area that gets accommodated or adapted, adaptation is said in the case of nerve. Okay, now what are the ionic basis for this accommodation? As we have discussed, when threshold stimulus is applied, sodium channels they are going to open. Okay, but when the threshold stimulus is constantly applied, what happens? When continuous threshold stimulus is applied, there is slow depolarization, and after that there is opening of potassium channels. It reaches here, then there is opening of potassium channel, and these potassium channels they overwhelm the depolarization. Okay, and there is because of this, when the potential reaches here only, then there is no generation of new action potential, and that is known as accommodation. Fine. Okay. So this is all about today's topic. We have discussed action potential. We have discussed properties of action potential. Now 10 questions. It is the time for questions. It will take less than 10 minutes to finish the session. Fine. So starting with the first question. That is, if you are live, you can give me the answer. And if you are watching the recorded video, then also you can give the answer. You can write down your own answer, and you can get it corrected later on. I will also discuss the answer. One, that is Rio base. What is Rio base? It is the length of a time a current is applied to produce response. Weakest current strength which can excite the tissue. Constant for any given excitable tissue, and it is used to compare the excitability of various tissue. Now what is Rio base? We have discussed here. This is Rio base, this one. Okay, can anyone give me answer? Answer of first is Atif Ali. Hello, you are also late. Now participate in the quiz. Fine. So you can say that. What is the answer of first? Can anyone answer me? Okay. If you are live, you can answer. If you are not able to, then it's fine. So Rio base is the correct answer is minimum strength. Very good. So this is answer is B. That is weakest strength which can excite the tissue. Fine. So this is the correct option. Okay. Very good. Very good. Next is Rio base is indicator of specificity of impulse transmission, current, rate of discharge, and velocity of nerve conduction. As I told you again, what is Rio base? It is minimum. This is Rio base. Okay, fine. Ali, okay, finish it. Anshu Kumari, beta, we have discussed Rio base, that is the current, strength of current. Fine. So what is the answer now? Okay, Atif Ali, you will finish all my lectures, watching all my lectures, and then you can join. Okay, but you can watch them before my class starts. Fine. Okay. Now what is the answer of second question? Can anyone tell me? Second is also B, that is current. Magnitude or strength is equal. Fine. Third answer, third question. Which of the following is unit of excitability? We have discussed. What is unit of excitability? This we have discussed. This is Rio base. This is Chronaxi. So what is the unit of excitability? Which one? Can anyone tell me? What is unit of excitability? No. We have discussed it is Chronaxi. Less the Chronaxi, more is the excitability. Okay. And longer the Chronaxi, लेस इज द एक्साइटेबिलिटी. इजी वे टू रिमेंबर मैं आपको बताती हूँ. अगर आप हम लोग बोलते हैं ना किसी को कि आपकी ट्यूबलाइट कम है, ट्यूबलाइट स्लो है, सो मीन्स इट रिक्वायर्स मोर टाइम, सो एक्साइटेबिलिटी इज लेस. सो क्रोनेक्सी इज द unit of excitability. Beta, you write down question and answer 3 or 4. Okay. Now chronaxi is minimum in myelinated fiber, unmyelinated, red muscle, white muscle. As I told you, chronaxi minimum is equal to excitability is more. Am I clear? Excitability is more. Chronaxi minimum. Fine. So which tissue has highest excitability? That is your myelinated nerve. So in myelinated nerve, chronaxi is minimum. Fine. Next is minimum chronaxi in which fibers? Type A fiber, B fiber, C fiber. I think all of you are knowing Erlanger gaseous classification. What is it? A alpha, beta, A beta, A gamma, A delta fibers, B fibers and C fibers. Okay. These are thick myelinated. These are thin fibers myelinated. And these are thinnest one, non-myelinated. Okay. So which one has highest chronaxi? Thick or thin? Can anyone tell me? Thick fibers or thin fiber? Which fibers they have highest chronaxi? And minimum chronaxi, which fibers they have minimum chronaxi? Can anyone tell me? Minimum chronaxi means maximum excitability, and maximum excitability means diameter is maximum. So which fibers they have maximum diameter? I have given the thick axon. Very good. So which are thick axon fiber? Type A fibers. Fine. Now next is all or none law. Refers to resting membrane potential, spike potential, excitatory postsynaptic potential, or strength of contraction. Okay. Another name of this spike potential is action potential. Now give me the answer. Answer of 6. Answer of 5 is correct, A. But please, Kishan, write down number of question. 1, 2, 3, 4, 5. What is the answer of 6? all or none law is followed by action potential. So that is the correct option. Fine. All or none law depends on the relationship between current strength and duration, duration of application, current strength and the response, magnitude of action potential and the response. All or none law means if we have applied threshold strength of stimulus, there is all response, and sub-threshold stimulus, no response. So you can see what is here. Okay, good. Pradeep, good. Pradeep, the answer is good. Strength and response. So this is your all or none law is based on the relationship between strength and response. Fine. Okay. Absolute 8 number refractory period, that is begins from the time the firing level is reached until the repolarization is complete. So here this is this one. Okay, so it is here to here, it is I think not. Fine. Then comes during this period no stimulus, no matter how strong, can initiate the tissue. During this period, stimulus stronger than usual can cause the excitation. This is relative refractory period. Fine. And during this period, more sodium channels open. No, potassium channels open. So your correct answer is this one. Absolute refractory period is the period during which no strength of stimulus can excite the tissue. Fine. Ninth one. An excitable cell adapt. Very good, Kishan. B answer. Excitable cell adapt to the applied stimulus due to slow opening of voltage gated potassium channel and delayed closure of voltage gated potassium channel both, and activation of sodium channel. We have discussed accommodation. When accommodation is there, what happens? The membrane is here, so there is delayed closure of voltage gated channel and slow opening, both are there. These channels, they open slowly and they remain open here, so the tissue gets adapted here. So the option is both A and B. Fine. Last one. A traveling nerve impulse does not depolarize the area behind it. You can see here there is depolarization here, this one. Okay, fine. Here. Okay, but this will go in this direction, not in this direction. Why? Because it is hyperpolarized, it is refractory, it is not self-propagating, and the conduction is always orthodromic. The answer is because immediately after action potential is here, now this period is refractory period, so it will not depolarize the area immediately behind it. Fine. So this is the 10th answer of MCQ. So we have completed today's topic. This action potential we have not completed, just we have started it. We will discuss monophasic and biphasic action potential and some other facts of the action potential in our tomorrow's class. Okay, so stay connected. One more announcement again, those who have joined late, that all topics notes of my lectures, they're available in soft copy as well as hard copy. If you want to get soft copy, you just have to download the app Vesalius and subscribe it, and if you wish to get hard copy, you have to order physiology notes from Flipkart or Amazon. On both of them that is available, so you can get hard copy also, as well as we have our app Practicable for practical, that is also available. Links for all these apps as well as my notes, this Flipkart and Amazon link, as well as all the app link, that is there in the description box of my video. So you can just click the link and you can get all these copies. One more announcement: if you like my video, you can like it, you can share with all your MBBS nursing, physiotherapy, homeopathy students, friends, so they can also benefited and they can also enhance their studies. That is another thing. Third thing is, you can not only subscribe the channel, you just hit the bell icon, so whenever I'm live you just have a ring. Okay, आपकी घंटी बज जाए कि मैडम अभी लाइव है और मैडम ने पढ़ाना स्टार्ट कर दिया है। जैसे हमारा क्लास स्टार्ट होता है घंटी बज जाती है, सेम वे ये भी घंटी बजनी चाहिए कि स्टार्ट क्लास हैज स्टार्टेड। फाइन, so thank you so much, thanks for being with me, stay connected and we will be going to complete the whole physiology.